Good evening. I'm Chief Investigative Reporter Stacy Cameron. 3 months ago, our documentary crew here at KSLA released Breakdown, the Frontline Response to the Mental Health Crisis, a film telling how local police officers and firefighters are getting dispatched to psychiatric emergencies on a daily basis. And because they lack the training to deal with the mentally ill, sometimes those calls for help turn tragic. But as we saw in Breakdown, Shreveport police and fire departments launched a first-of-its-kind program in Louisiana designed to train all of the city's first responders in crisis intervention and hopefully de-escalate mental health calls. Following our film, support from viewers and health professionals was so great, department chiefs decided to expand the program and develop a dedicated mental health unit that may soon get dispatched to psychiatric emergencies all over the city. Recently, I sat down with 3 people involved in developing this new unit, Calvin Baker Jr. with the Shreveport Fire Department and Sergeant Rachel Alkire and Lieutenant Amy Bowman with SPD. We started our conversation off with this fact. Roughly 35% of the people in our community struggle with mental illness, and because we lack the resources to treat them, a growing number of those folks end up calling 911 and asking police and paramedics for psychiatric help.
You know, we could have the conversation that, police and fire may not always be the best fit to address mental health concerns, but people still call 911. So, we have to look at what are better practices for us to go out there and serve the community, and how do we connect people better to services?
People, when there's a crisis, whether it's a mental health crisis or some other crisis, they pick up the phone, they call 911, they know somebody is coming. Whether or not that's the best person to handle the crisis at the time may or may not be the case, but if we can connect caretakers, patients, family members, neighbors, whatever, to resources, so that the next time there's a mental health crisis or there's a mental health crisis on the horizon, that they know there's other resources, and oftentimes better resources than to pick up the phone and call 911 and get law enforcement.
I understand that you're looking at the model of some type of community response model for a mental health unit. Explain to me what that is and what it might look like.
What we'd like to see going forward is maybe some type of co-responder model. So if we were in unmarked cars, maybe dressed down so that it reduces some of that trauma that some of the individuals may have had in recent past with law enforcement, that maybe that kind of bridges that gap and makes it a little bit easier for us to kind of connect them to services so they don't have that negative interaction with law enforcement.
So in that co-responder model, that might also have someone who's dealing with social work from an agency, someone who might be a therapist that is able to go out with you all and speak with these people and get them into the right resources?
Correct. So we were actually looking at, we've had a couple of companies reach out to us on some telehealth models. And what that may mean is that we have officers that are CIT trained on different shifts that might have telehealth options out there in the field, that you might have somebody that's in social services that could do that basic assessment on an individual that's in crisis and kind of determine what level of care that they need, and then we kind of coordinate that care to figure out what's best practice and what resource do they really need. Because right now a lot of the options for law enforcement only involve either taking them to the hospital under protective order or jail, and we know that that doesn't always work, and that's really not the level of care that somebody might need.
Whose legal responsibility is it to transport a patient once you know this is a mental health issue and there's not an underlying medical condition?
If it's an emergency commitment, that falls back on law enforcement. That falls back on us, that if they meet the criteria for an emergency commitment, it's our responsibility to get them to the hospital for that initial evaluation.
And I imagine that can create some obstacles, because if you're responsible for committing the folks, some may not understand because they see the badge and they see the gun that you're taking them somewhere to help them. They may suddenly assume
they're going to jail.
I'm going to jail. And is that one of the reasons why we think maybe going in plain clothes and going as a co-responder model might help you navigate those situations better?
That's our hope. I can be a police officer, but I can also be a person there that's there to help you. And if you see the uniform initially, that's all you see at first, and that's all most people see whenever a police officer gets out of a marked unit and is wearing a uniform, is they instantly think, okay, somebody's going to jail. They don't think, hey, they're here to help. And so that kind of takes that barrier down by showing up in unmarked cars and in plain clothes. And some people, depending upon their mental health diagnoses, just the appearance of a uniform or a marked unit can escalate an already somewhat volatile situation.
And what about you all, Calvin, on the fire perspective? When you are assessing a patient, you realize this is a mental health issue. What are the options available to you?
Our thing is to work better with the police and finding that solution. Do we need to put them in protective custody, or do we need to take them to the ER because they're dealing with some type of medical emergency, not necessarily mental illness, or mental illness and substance abuse together? So educating those guys to see that, to minimize harm from that individual or that patient.
You've touched on the idea that you hope to have this co-responder model at some point in the future. What's the biggest hurdle in actually making that happen?
Initially, we had to really kind of determine what our crisis response system was in Shreveport. So that was a challenge for us because it's really kind of out of the scope of what law enforcement typically does. So we really didn't know what services do we connect people to. So we had to identify what those resources were going to be. So we didn't really understand what the crisis response was. So then we thought, probably best practice was to form an advisory council of those mental health professionals, substance abuse professionals that are already doing that can really kind of help us determine better practices, what the community would like to see going forward, and what our policies and procedures should look like so that we can better serve those individuals.
Unfortunately, we live in a world where any great idea has to be funded. And this, obviously, if it's an extended program that you want to sustain, is going to become costly. How do we look at that and find funding resources?
We do have to identify, what are the needs going to be going forward on crisis response? And what do we need to do to fund that long term? Is it unmarked cars that we might need? Do we need more 911 dispatchers to kind of fill in those gaps for those crisis type calls? And is it funding toward housing or whatever? And we've reached out to Community Foundation, Community Development, to look at their federal funding options, grants that might be out there that might help sustain this long term, because what we don't want to do is start something and then it fail because we don't have the proper funding for it. So yeah, those are different.
And one of our big resources that we're lacking, like Amy said, is bodies, is people right now. We're just on both police and fire. Everybody is hurting for people.
Your agencies are working towards making the commitment to having people dedicated to deal with mental health. How do we do that in a department, in two departments that are short?
Well, I think if you start to really look at the data, and that's what we're trying to do, that there's so many mental health related calls that would it be a better practice to maybe take two officers that are really good at communication and de-escalation and send them to the majority of those types of calls? I mean, you're looking at numbers basically. So I think if we start kind of a pilot program and we look at it small with just two officers and a supervisor, and we're networking with a lot of the other agencies that already deal with mental health and substance abuse and some of the assertive care teams, we'll just have to kind of assess that and it be really data driven and see what the needs are going forward.
So ideally, this dedicated unit could go out and deal with calls that are coded as mental health, so that other officers and other firefighters don't have to go to these calls that are mental health based, and they can go deal with other emergencies, fires, car accidents, a shooting perhaps.
Yeah, ideally that's what we'd like to do. So if every officer is crisis intervention trained, what we would typically do is have those officers that are CIT trained go out there on those mental health calls. They would kind of make that scene safe to make sure that there's no immediate threat of violence. And then you'd have these kind of co-responder models kind of come in and be able to do a little further assessment, a little more dialogue, and maybe connect them to services. Because typically patrol officers they're called to call. They really don't have the time to be able to spend 30 minutes, 45 minutes on an assessment, really trying to connect people to services. And that's kind of where this co-responder model would come in.
And a lot of those they don't require law enforcement presence. It's not a law enforcement matter. It's maybe not even an EMS matter. But if we, again, like I said earlier, if we can connect the family members and the caretakers to resources that are available in the community, then the hopes would be that down the road, it would lessen those calls to 911 so that whenever there is a crisis, they contact those resources as opposed to pulling resources from the emergency and first responder.
Do you think some people will be surprised to see that our police department and our fire department are really serving as the stick that's stirring the drink here in Shreveport to solving this mental health crisis, at least on a street level?
I think we're the ones who respond. We're the ones, they call 911, and so we're the ones first on scene. So probably, yes, they could be surprised, but you would think, you know, when somebody is in any kind of crisis, 911, who's going to show up? Police and fire.